Hello, everyone, and welcome to today's International Nursing Webinar Series organized with the Filipino Nursing Diaspora Network, Nursing for Humanity, Beta Nu Delta Nursing Society. Our topic today is a mixed method study on the doctoral program for nurses in the Philippines. Perceived importance, impact, challenges, changes, chances, and choices. And this will be delivered by Dr. Kenneth Veluya. So myself, Jerome Babate, Dr. Sorianto, and of course, later our colleague, Dr. Pei, will be hosting and moderating this program. Now, we're very excited to be hosting this session today. Okay.
And today's webinar will be held for the next 60 minutes. It will be started with 20 minutes presentation by our guest speaker, followed by a question and answer session for a maximum 20 minutes. It should be 86 registered participants for today's seminar, but now we have about like 6 participants for now, but it should be all right. And then Dr. Bapete, please continue.
All right, thank you. So just for a quick overview, Dr. Sorianto is with the School of Nursing at Brawijaya University in Indonesia. Okay, just want to discuss the relevant session protocol. The first is, before we go further, I want to review the functionality of the Zoom platform. Okay, so your active participation is very important throughout the session. Right now, I have everyone on mute to avoid background noises that may distract you from listening to the webinar. But throughout the presentation, someone on my staff will be managing the chat functionality. You can enter your questions and comments in the question box throughout the presentation. If you rather ask in person, you can also use the icon on the control panel to raise your hand to indicate that you have a question. Once you raise your hand, someone will unmute your line so that you can ask your question.
And before we start, I would like to introduce our guest speaker today, Dr. Kenneth Veluya. Nurse is an associate professor in the College of Nursing at Calayan Educational Foundation, Lucena City Philippines. Over a 20-year career as a professional nurse, he has worked as a staff nurse and head nurse on the operating room complex at Lucena United Doctors Hospital and Medical Center, and eventually become a full-time clinical instructor in the College of Nursing. He graduated with a master's degree in nursing in 2008 and will be finishing his Doctor of Philosophy in Nursing at Our Lady of Fatima, University of Valenzuela, Metro Manila, Philippines, as Commission on Higher Education Scholar this coming April 2020. As a academician, he is currently involved in various nursing organizations such as Operating Room Nurses Association of the Philippines, Philippine Nursing Research Society, Philippine Nurse Association, and Sigma Theta Tau International Honor Society of Nursing. Today, he will talk about a mixed method study on the doctoral programs for nurses in the Philippines, perceived importance, impact, challenges, change, chance, and choices.
Before I hand the mic over to Dr. Veluya, I have a few housekeeping items to cover about this presentation and the webinar platform, of course. First, today's webinar will be available after the live session and is accessible on YouTube. We'll send you the link to the recording of this event so that you can share it with your social networks. Next, we'd like to hear from your today's presentation. At last, we'd like to encourage you to share today's webinar with your social networks. So without any further hesitation, I'd like to kick things by welcoming our guest speaker, Dr.
My topic is about the doctoral programs in nursing. The main title of the paper that I will present to you is a mixed study on the doctoral program for nurses in the Philippines. Perceived importance, impact, challenges, changes, chances, and choices. Again, a pleasant morning to everybody. To begin with, here in the Philippines, we have several descriptions of the doctorate program for nurses. And these are Doctor of Philosophy in Nursing, Doctor of Philosophy in Nursing Education, Doctor of Philosophy in Nursing Science, Doctor of Nursing Management, Doctor of Science in Nursing, and Doctor in Nursing Science. I've come to arrive to this particular topic because at our contemporary days, nurses portray diverse roles. This diversity in roles is influenced by complex healthcare system, the medical advancement, the technological breakthrough, and changes in government policy. All these issues become the antecedents for the worldwide demand of nurses who are doctorally paired. But research reports that there is an increasing inadequacy of nurses who are taking up doctoral degrees. As depicted, majority of professional nurses are non-doctoral. Only 1/3 have doctoral degrees directly related to nursing, and some are not related or non-nursing doctoral degrees. Inspired with these issues and problems, as a researcher, I am enthused to find out what are the importance, impact, challenges, changes, chances, and choices experienced by those nurses who have earned their doctoral degree in nursing. In particular, I have worked on these specific problems. First is to describe the profile of the respondents in terms of age, gender, institution attended for the doctoral program, the doctoral degree earned, major in what area, the practice area pre-doctoral program, and the practice area post-doctoral program. Second is to determine the perceived level of importance of the doctoral programs in nursing among the respondents concerning the following aspects: patient care, research, leadership and management, policymaking, and professional identity. The third is to determine the respondents' assessment of the perceived impact of doctoral program in nursing in the following professional competencies: evidence-based practice, interprofessional teamwork, advanced nursing practice, quality improvement, and the use of information technology. Followed by finding out if there is a significant difference on the assessment of the respondents' perceived level of importance and perceived impact of the doctoral program in nursing when they are grouped according to their profile. As well as to find out the significant relationship between the perceived level of importance and perceived impact of the doctoral programs in nursing. Likewise, the study also dug in the experiences of the participants with regards to their journey towards a doctoral degree with the following questions: what characterizes the challenges experienced by the participants on the doctoral programs in nursing? What are the changes experienced by these participants? What typifies the chances that the participants encountered on their pursuit of the doctoral programs in nursing? And what are the choices that the participants have to make on their pursuit of the doctoral degree in nursing? With the following problems, it is also my aim as a researcher to develop a conceptual model out of this study. The study utilizes the explanatory mixed method approach in order to address the various research goals. The descriptive explanatory, descriptive comparative, and descriptive correlational were utilized in the quantitative approach, while the content analysis was applied in the qualitative approach. Descriptive explanatory to address the research goals regarding profiles of the respondents, perceived importance, and perceived impact of the doctoral programs in nursing. Descriptive comparative and descriptive correlational to determine and compare the responses on importance and impact when grouped to profile, as well as to find relationship between the perceived importance and impact. The qualitative content analysis design was used to focus on the meaning of the challenges, changes, chances, and choices experienced by the participants in the pursuit of the doctoral degree in nursing. Based on the research locale, there was no specific location of the study since the participants were those who graduated any doctoral degree in nursing in the various colleges and universities all over the Philippines. To date, there are 15 institutions offering doctoral programs. In Luzon, we have 10. In Visayas, there are 4. And in Mindanao, there is only a sole college offering doctoral degree in nursing. For the population and sampling, the target participants of the study were the total number of nurses who graduated from the different doctoral programs in nursing from various colleges and universities in the Philippines. 132 joined or participated in the study on the quantitative part. The nested sampling technique was employed to derive the key informants for the qualitative part, and there are 10 who participated. On the research instrument, the researcher have constructed a questionnaire based on the literature, supporting literatures. The questionnaire is made up of 3 parts. First is dealing with the profile. Second would be dealing with the perceived importance, and the other one would be dealing on the perceived impact. As well as I have also constructed an aid memoir for my semi-structured interview. So I have used an aid memoir for my interview to gather the qualitative data. For the testing of reliability and validity of my instrument, I have subjected it for pilot testing or pre-testing, and it have gained a Cronbach alpha result of 0.817. The study exercised all the necessary ethical procedures during the conduct of data gathering. It was subjected to ethical review by the Institutional Ethical Review Committee. Informed consent were obtained before the respondent answer and key informant participate. All information were kept confidential. Identities were not revealed in the research reports. On data gathering, permission letter to conduct the study from the president and the deans of the universities or colleges offering doctoral degree in nursing, with endorsement letter noted by my advisor and the recommendation from the dean of the graduate school. Following approval, the questionnaire were distributed personally and through the help of the online platform SurveyMonkey. After that, interviews were conducted. On data analysis, the quantitative data was treated using the frequency and percentage, weighted mean, standard deviation, Mann-Whitney U-test, Kruskal-Wallis, and Spearman correlation through the use of the SPSS software. Content analysis method was used to analyze the gathered qualitative data, and with the aid of in vivo software in order to manage the data. Based on the results, finding shows that the age of nurses in the Philippines entering the Doctor of Philosophy in Nursing, they enter the Doctor of Philosophy in Nursing once they are established in their field. And that reveals about 37.9% belonging to the 31 to 40 years old and 41 to 50 years old with 36.4%. Based on gender, it still may be deduced that the nursing profession is still a female-dominated profession. But as you can see on the result, there is only a slight difference between female and male respondents. On the institution attended the doctoral program, majority of the respondents came from universities inside Metro Manila or the Luzon area. They have earned Doctor of Philosophy in Nursing, major in Nursing Administration, and practicing on educational field as a professor and researcher. After they have gained the doctoral degree, there is a drastic increase that the participants have participated mostly in research coupled with their previous practice area. Based on the result of perceived importance of the doctoral programs in nursing, the respondent perceived that the doctoral programs in nursing were very important in all aspects. particularly in leadership and management, research, policy making, professional identity, and patient care. All of them got a weighted mean of within the range of 3.25 to 4.0, which is interpreted as very important. Based on the perceived impact of the doctoral programs in nursing, the respondents strongly agreed that the doctoral programs in nursing could impact their professional competencies in quality improvement, evidence-based practice, interprofessional teamwork, advanced care nursing, and the use of instructional technology. All of them still got a weighted mean within the range of 3.25 to 4.0, which is verbally interpreted as strongly agreed. Based on the result on the differences on perceived importance of the doctoral program in nursing, according to profile, almost all of the computed p-values are less than the 0.05 level of significance. Therefore, there is a significant difference. On the result on the differences on perceived impact of the doctoral program in nursing, according to their profile, again, quality improvement, evidence-based practice, advanced care nursing, and the use of information technology all got a computed p-values less than the 0.05 level of significance. Therefore, there is still a significant relationship. This is the result of the relationship between the perceived importance and perceived impact of the doctoral programs in nursing. And as you can see on the result, the research, professional identity, and leadership and management, these are all having a high score or high p-values, which means that there is a strong or relationship between the perceived importance and perceived impact of the doctoral programs in nursing. Moving on with the results on the qualitative part of my study, the challenges experienced by the participants on the doctoral programs in nursing are time, financial, and program requirements. These are the sub-themes that emerge, but later on these sub-themes are rewarded by the researcher so that I can have a model based on the result of this qualitative portion. Financial will be all affecting the relationship. The time, there is an individual responsibility and social responsibility to time. And most of the participants avail that the requirements on their doctoral degrees also poses to them as a challenge. Based on the changes experienced by the participants on the doctoral programs in nursing, there are personal, social, and professional changes. The sub-themes that emerge were self-worth, which are manifested by the individual's increased respect. They become more goal-oriented, confident, and their personality becomes stronger. On social connectedness, the participants claimed that they have gained camaraderie, get to socialize with other professionals. And on professional aspect, a specialization and professional awareness increases as well as career advancement. On the chances that the participants encountered during the pursuit of the doctoral programs in nursing, opportunities for higher position, salary, and role expansion were the major themes, which I reformulated as exploration, expansion, and elevation. These sub-themes that have emerged will be later on further explained on the model that I have formulated. there is a relevance why I have formulated it with similar beginning letters. On the choices that the participants made on their pursuit of the doctoral programs in nursing, improvement of self, which I deduce that is to grow, the need to help others or to go, and responsibility to contribute to their profession or to grow. With that particular results on the qualitative portion, the researcher or I have formulated a model which I have entitled the preset three-layered spear model, eidetic on the life world of doctoral nurses, challenges, changes, chances, and choices. The four major themes generated from the study, the challenges, the changes, the chances, and the choices, experienced by the participants during or from their journey of their doctoral degrees. Overlapping circles signify the three sub-themes from each major themes which emerge from the study. The four quadrants dividing the three spheres define the life world embedded in the doctoral in nursing graduates. Narratives from their lived experience in the graduate school, society, work, and family. The inner sphere represent the personal life world which evolved in their work and family. They have personal challenges, responsibility to their families. They have personal changes, which is self-worth. They have personal chances, exploration of self, and they have personal choices to grow. The middle sphere corresponds to their society. With relationship to other people, being challenged, social connectedness or social consciousness sprouts as change. Expansion of network appears as chance and to go as choice. The outer sphere illustrates the profession which was challenged by requirements, changed through specialization, benefited by elevation, and chosen to grow. Based on the result of the study, the following conclusions are presented. Doctorate nurses perceive that the doctoral programs in nursing provide great importance on leadership, management, research, policymaking, professional identity, and patient care. Doctorate nurses recognize that the doctoral program in nursing bring forth great impact on professional competencies such as quality improvement, evidence-based practice, interprofessional teamwork, advanced care nursing, and use of information technology. The impact of the doctoral program in nursing can be associated to its importance to nursing practice. The doctorate nurses experience struggles on managing their responsibilities to self and other people, particularly on scheduling personal, social, and professional functions. The doctoral journey transformed a person positively. The doctoral degree offered opportunities for self-exploration, role expansion, and professional elevation. The doctorate nurses choose to grow as a person, to go on helping others, and to glow and shed light to the nursing profession. Based on the conclusion of the study, the following recommendations are presented. It is recommended that the higher educational institutions all over the Philippines offering postgraduate doctoral education should also consider Doctor of Philosophy in Nursing in their program offerings. Doctorate in nursing graduate should collaborate and encourage academic practice partnership. The professional competencies identified in this study may be utilized in designing the appropriateness of the course offerings of doctoral programs in nursing. Organizations and employers should encourage and support aspiring employees to develop doctorally prepared nurse leaders, educators, and researchers. Organizations and employers should assess the receptivity of the practice environment to potential changes resulting from finishing doctoral programs in nursing. Likewise, it is recommended that further study be conducted to track the professional career development of doctorate nurses. As I have said in my introductory statement, we are in unpredictable, surreal times right now. The timing is right for a call to action for nurses, nursing leaders, doctorate nurses, to play a strategic role to collaborate, conduct researches, which will lead to policy making for the improvement of patient care delivery. So here is my email address and contact number. I am free to collaborate with local researchers on topics including nursing education and clinical nursing practice. And if it is also possible, we can also collaborate with one another by forming an international cadres of professional nurses who have doctorate degrees, just like what we did in the Philippines. We have formed the doctorate nurses in the Philippines, where it will serve as a social platform for future projects, researches, and other nursing-related conversation that will help to ameliorate condition of the nursing profession. Again, thank you, and to God be the glory.
All right. Okay. Thank you very much, Dr. Kenneth.
Thank you po.
Yeah. It was a wonderful presentation, Dr. Veluya. Okay. Is there anything you want to say, Dr. Sorianto, before we go to the questions and answer? All right. Anyway.
Yep. So, yeah, thank you very much, Dr. Veluya. It was a great presentation, and you know, we try to, from Indonesian perspective, we try to, try to think what happened in Philippines regarding the doctoral degree in nursing, blah blah blah, and compared to Indonesia. Thank you very much. It was a great presentation. Should we proceed to the question and answer?
Yeah, probably before the question and answer. Yeah, I made an initial data gathering of doctorally prepared nurses in Southeast Asia, and I found out that in the Philippines, at least there are close to 200 of nurses have these qualifications in the Philippines, and a good percentage of them have already gone to have gone abroad and doing academic engagement. I think Indonesia is having a good number of doctorally prepared nurses as well.
Not many.
Yeah, but there's one school in Indonesia that is doing good. They have one faculty of nursing or school of nursing, which has 11 doctorally prepared faculty members. That's good enough. Yeah, that's good enough. And then Thailand is having a good number of this kind of specialists across a number of universities in Thailand. On the other hand, in Singapore, there's only one university there, but again, they offer like a PhD program, and it's considered the School of Nursing at the National University of Singapore is considered a world-class faculty. Okay, Malaysia has quite a number as well. but not in the vicinity of Indonesia and the Philippines. Brunei has only have 2 doctorally prepared nurses. Anyway, those are just for
It's good to know, Doc, that nurses are now aware that they have to grow professionally in their profession.
Okay, thank you very much, Dr. Ken. Yeah, Dr. Suryanto,
Yep.
I've sent you 2 questions from my email. I got an email message from
Yeah, sure.
the participants. Yeah,
Yep.
maybe you can read them.
Yep, sure. Thank you very much, Professor Babati. So the question number 1 is, why are there currently so few doctorally prepared nurses who want to teach and conduct research, and so many master prepared nurses who do not want to pursue a doctor? So do you have any idea about what is happening in Philippines? Why there are so not many doctorally prepared nurses who want to teach and conduct research in Philippines? Do you have any idea about that, Dr. Veluya?
Pardon, Dr. Sorianto, for the question.
Yep. So why are there currently so few doctorally prepared nurses who want to teach and conduct research? I think why not really many people want to do a research in Philippines. Yep. Is it hard to do a research in Philippines, or do you have any idea why not many people are not really interested in research kind of thing?
At first, if the mindset of a graduate student or an individual is not fully centered on their goal or aim, research would be very difficult for them. But as you go along during your academe or during your enrollment on the education landscape of the graduate school, you can realize that research is just like eating a peanut, because there are a lot of professors who will be helping you, extending their arms, extending their full support on you, just like what we have now. We have a lot of professors, researchers that are helping one another for good practice, evidence-based practice, and research-oriented studies. So it is just mindset of the individual. I think that's why they are afraid in research. But once you get hooked into it, you'll surely love research.
Yes, I do agree that one. So, but the term of evidence-based practice or evidence-based nursing, is it well known in Philippines that every nurses know that they must apply the evidence-based for their practice, daily practice? Is it well known on that?
On the undergraduate level and some of the masteral level, it is not yet clear the evidence-based, the very essence of evidence-based practice. But as you go along to a much higher level of education, just like doctorate education, it will be stipulated and clearly discussed. So you will have a clear vision of what an evidence-based practice really is.
Right. Great. Thank you very much, Dr. Veluya. Professor Babate, do you want to read the second question, or should I read it?
Yeah, I can read the second question. Thank you for the answers, Dr. Ken. Second question is, what do we have to offer our younger generation of nurses? We aspire to recruit in the doctoral nursing program when our salaries are very low in the Philippines.
As depicted on the result of my study, as you finish your degree in Doctor of Philosophy in Nursing, there are not only financial gain, there are also social gain and professional fulfillment that you could achieve. So financial gain, I think there are some institutions who are now ready and receptive of the doctorally prepared nurses, and they are actually offering higher position, and with that higher position, there are also financial returns. But but as I have said, aside from the financial gain, there are still social responsiveness and professional upliftment that you can gain once you finish your doctor or doctoral degrees.
All right. Thank you very much for that. Dr. Suryanto.
Yep. So thank you very much, Dr. Kenneth. The third question is, what do we really believe doctorally prepared nurse teachers, scholars, and leaders in education and healthcare should be and do? So what's the expectation? What's the hope for them related with the education and healthcare? What should they do? They should do research, or what should they do related with the healthcare and education?
In my experience, I could say that being a doctorally prepared nurse entails a lot of responsibility as well. So this responsibility will be your commitment also to your profession. You can be one of the pool of experts that will lend a hand to those nurses who are not yet, or shall I say, on the beginning level of achieving their professional upliftment. So aside from that, leadership and management will emanate from these doctorally prepared nurses, because they have learned that being a doctorally prepared also gives them the leverage to become good leaders and be one of the policymakers as well. So using these particular competencies and skills, the doctorate prepared nurse can be helpful in addressing these issues and problems in the nursing profession.
Great. Thank you very much, Dr. Kenneth Veluya. So for the online participants, do you have any question for Dr. Kenneth Veluya? So you can raise your hand, or you can write your question within the chat inquiry. So please feel free.
Yes.
Dr. Suryanto. Okay.
Oh yes. Dr. Sabodi.
Dr. Suryanto. I just got a sorry. I just got an email again.
Okay,
and the question reads, in your presentation, close to 70%, okay, who are doing their doctorates are already 30 years old and above, okay?
Yes.
So that leaves you with only 30% with those under 30. So what does this mean in terms of productivity, research productivity? When you have these cohorts, I think 30% of that is also 40 and above. What does this mean in terms of research productivity?
I think this is leading to a more productive researches, because the age group of 30 to 40 or 45 age group are very active. They are very proactive, and they are very aggressive in doing researches. Not taking aside also the expertise of those who are on the elder bracket, but I think this will lead to a more researches.
All right. Okay. Thank you, Dr. Suryanto.
Yes, thank you very much. So is there any question from the floor who are online? So far, we are now having 19 participants who are online. So do you have any questions for Dr. Ken, please?
I don't have any question to the participant, but as I have said on my introduction, I just want them to be safe, and I am expressing my gratitude to them, because despite of these trying times, they have tried to attend to this webinar. I hope I have given some enlightenment on the future, for their future on Doctor of Philosophy in Nursing.
Yep, thank you very much. So, Professor Bapate, I think our colleagues Joel Ray Akop want to ask. Could you please unmute his mic,
All right.
please?
Okay.
So,
All right.
Dr.
Sorry.
Joel Ray Akop. Yep.
Sorry for that. Let's have a look at Dr. Ako.
Yep.
Dr. Ako, we can't see Dr. Ako.
I think just close to you.
Yeah, oh yeah, sorry. Yep, good. Okay. Dr. Ako.
Yes, hello. Thank you, Dr. Babati and Dr. Sorianto. Good morning, Dr. The presenter. The study is timely and is very much of importance, especially now that CHED Philippines is trying to require that every School of Nursing should have at least a master's or a doctorally prepared faculty for them to follow up in the respective hospital or clinical duty. However, based on your presentation, that prior to the entrance to doctoral degree, there were a good number of these particular nurses, and right after the completion of that doctoral degree, the clinicals or those nurses working in the hospitals slightly decreased, which perhaps may communicate that they are shifting paradigms, or if not, they are attracted to be working in the academic institution. So with this, there would be a problem because we are getting a lesser number of working in the hospital, which are doctorally prepared. What is your view to this? Is this a positive sign that after they graduated their doctoral degree, they immediately change career or joining into the academic institutions?
Thank you for that very analytical question, Dr. Joel Akub. I would like to clarify based on the findings that there is not necessarily a shift of workplace, but an additional responsibilities to them. Some of them are venturing into part-time into clinical area because some of them are teaching research subjects in the graduate school, but still they are working on their clinical practices because most of the respondents or the participants stated that research is not so much practice or not that practice as compared to educational landscape. But this is a good, there is a good implication also with this because as nurses become doctorally prepared, we can be an advocate for the rights of those nurses in our sectors like the clinical, those frontliners. We can be an advocate for them and be the voice for the lobbying of policies with regards to the needs and rights of our nurses.
Mm-hmm.
Okay.
Okay. Yes. Thank you for that. I may have a follow-up question, Dr. Jerome.
Yeah, sure, absolutely.
Yep.
Okay. Yes. Since the CHED is telling the academe that we should be masterly or like masters or doctorally prepared and are capable of supervising students in the area, and we know that not all are called for this calling to teach. It's not everyone's cup of tea. Others are actually into industry, even if they are doctorally prepared, but they don't have that love, that passion to teaching, right? So Can we, or can you now see, or can you now guarantee that your study will become a ground for policy development, that those doctorally prepared staff nurses should be the one to supervise students once they are into the area, over that of the nurses or our nurse educators who are really focusing into their academic works? Because based also on my anecdotals or with my readings, most if not all of the faculty members don't have that rich experience in the industry, which incapables them perhaps to supervise students because they don't have the experience in the hospital. But they were able to be qualified because of their doctoral preparations. So can we have like a connection or meeting the gap that those PhD prepared nurses working in the hospital should be the one supervising the students once they are on duty?
Uh, Again, I would like to thank you for that very timely question, Dr. Acob. No, this insight that you have brought into the open is a very good insight, because I think it is right, it is but right that who should follow up those students are those who have masters, or the basic requirements of the Commission on Higher Education
Basic,
is
yes.
the masteral degree. So masters or doctoral degree, that is additional edge for a professor being a doctorate degree. But you are right that those who have vast clinical experiences plus their master's and doctorate degree, they should be the one who will be teaching or manning the education of our students, because their experience on the clinical practice coupled with this higher educational background of being a master, this is a good recipe for a very competent and globally acceptable nurse practitioner.
All right,
Mhm.
thank you for that one.
Yes.
It's actually a sensitive issue when you look at uh, approaching Dr. Joel Acob's question. A lot of factors that can be considered from that. Uh,
Yes.
Largely because, as I've said earlier, we only have a small number of doctorally prepared nurses. So if you make this mandatory to everyone, we have more or less 350 nursing schools in the Philippines versus like 130 plus doctorally prepared nurses or educators. So it's you see a disparity in terms of supply and demand for in nursing education. Yeah, that's one portion, very important as well. And of course, the push factors to go abroad is another very important consideration. Okay, many of them just after getting the doctoral credentials, they go to Middle East, and yeah, because the uh, the financial attraction. Yeah, I think we've covered the most important questions here. What do you think, Dr. Suryanto?
Yeah, I would agree that one. Replying your last statement that most of the, Professor Babati commenting about the after they graduated, they got the bachelor degree and they went to Middle East for work there. Do you think that the salary is not that high to be a doctor in nursing in Philippines? The salary is not good
Uh,
income for doctoral.
I think
I
the
mean,
Middle East. We have the benchmark as for the Middle East salary. It could be five
oh,
times
right.
the rate.
Compared to
So
Philippines, yeah.
yeah,
Mhm.
it looks like that one is really unattractive factor.
Yep. Sure.
Yeah, and then of course
So,
the other thing is the challenge of getting research support from abroad. You don't get this in the Philippines, or maybe in Southeast Asia you can't get this.
yeah. Yeah, I do agree that one.
Yeah.
Yes. So also in Indonesia, that research is not really what I can say, that not all nurses are really interested in research. And for someone who already graduated doctoral degree in nursing, most of them are back to university, back to the school of nursing, and focusing on how to teach the student to do research, not really expand their research. Their own research become like more beneficial for nursing care, that kind of thing. So like Dr. Kenneth Veluya mentioned, that it's really depend on the mindset of the people itself. So how we can give them more broader knowledge that research is not just based on school, based on the university, but it must be done by all nurses who are work on clinical, because like the evidence-based nursing is really important for our patients, and also for good for economic and etc. So that's the thing that we should emphasize for all nurses in clinical practice, I guess.
All right. Okay. Thank you very much, Dr. Sorianto. It looks like we've covered all our questions. Mr. Dr. Veluya, is there anything else you wanted to cover before we wrap up?
Again, I would like to thank everybody, and be safe always.
Okay. Okay, great. Thank you, everyone. We appreciate you being here. At this juncture, I would like to thank the Filipino Nursing Diaspora Network, Beta Nu Delta Nursing Society, Nursing for Humanity, the Educational Solutions for Professional Advancement. Okay, and of course, Dr. Veluya and Dr. Sorianto as our facilitator. And finally, the participants. Thank you very much for joining today, and see you in the next webinar. Ciao.
Thank you very much, everyone. Thank you. Bye.
Thank you.
So just I would like to mention to all the participants who are still in here.